As I was introduced, I'm Suzanne. I'm a sexual health nurse practitioner. I've been asked to speak today a little bit around how networking and partnerships can actually be an important thing to look at and to consider when we're looking at limited access for sexual health services for some of our most vulnerable young people. But I think to do that, I'll need first to give you a little bit of a background to the creation of my role and how this type of a role then enables the next step to happen. So the objectives I thought for today were to review the impact of providing sexual health clinical services using an outreach model of care, particularly when you're considering the rural setting, to describe the model of care that I operate under, to appreciate the building of networks and partnerships, and to look at the benefits that this can give to some of our client groups. The role I'm in was created through a partnership between CERSH, which is the Centre for Excellence in Rural Sexual Health, a unit of the University of Melbourne, and Goulburn Valley Health, which, lucky for me, they did all the groundwork for the initial creation of the position. I was then just fortunate enough to apply and be given the opportunity to take on this role initially as a nurse practitioner candidate. The development of the role came about and was driven by the need to offer clients timely access to sexual health services and hopefully improve client outcomes in areas where sometimes services are limited. In 2010, CERSH approached Goulburn Valley Health to partner in the creation of this role and convinced them of the need for improved access and provision of clinical services in the region, because as we know previously, everything had been fairly much metrocentric. They developed what they considered would be a sustainable business model and shared the cost of the position creation and service for the first 5 years, and that will be up at the end of June next year, so it will be time then to see whether the role has been embedded enough within this region for the hospital to take on the cost of it continuing. A client-centred, outreach-focused rural service was the key to reaching those most at risk and who historically had least access to specialist, confidential, affordable sexual health service provision. So this is my hope of what I could try and bring. For me, I try to be Melbourne Sexual Health Service in one person. Don't succeed, I feel often, but any little bit I think is better than nothing. We know back in 2003 when Henny Williams was part of Family Planning Victoria, she with colleagues undertook a review of sexual health services across the state, and one of the outcomes from that was the recommendation that there should be a sexual health nurse practitioner in each DHS region, for that person then to be like a central hub for a hub and spoke model to actually support and capacity build sexual health services within those areas to again bring out these types of services from metropolitan. The strengths are that you really could potentially be a one-stop shop, that you could walk into anywhere, provide the service and walk away without really any major infrastructure or any other cost involved, particularly if you're someone who maybe is more organised than me but can actually package things down easily, take everything with you, provide the service, take specimens away, provide treatments, and there really isn't a need for any other service to be involved, and you can translate that into pretty much any setting. It doesn't need to be a clinical room, and hopefully that's what we can talk about today and say, you know, think about some of these as potential options when you're looking at models for provision of sexual health care to your young people. My brief, apart from clinical service provision, is also to capacity build across the Hume region. I think you probably all know where the Hume region is. I need to remind myself from time to time. At this point, I haven't got across towards sort of Yea, Alexandra, those areas very much, but then again at the same time I haven't been invited really either. That's something maybe to think about for the future. And I have been up as far as Tallangatta to visit. I do go outside the Hume region though if I'm invited, because I figure at this point in time within this role I'm the only rural sexual health nurse practitioner, and if there's anyone anywhere who would like some support, some information, sit down, have a coffee, think about how things could be translated to their location, I'll be there. My role has been promoted from its inception through the Sexual Health Network meetings across the Hume region. Certainly around the Goulburn Valley, there are a number of people who are aware of my role. Most of the adolescent school nurses within that area are aware of me. I would like to think word of mouth would be helpful. This is my model of care. As I said, it's effectively a hub and spoke model. I would like to think ultimately we would get this picture where we have a lot more little satellites happening all over the region, and you would then network within yourselves and support each other. But I know that is going to be, I feel, a long time coming. But as you can see from my model, it's capacity building, but it also gives me the option of doing community-based nurse practitioner-led satellite clinics. So I could potentially walk into a location, do my clinic and walk away. There is no need for any of the red tape around, what are they, MOUs. Thank you. Memorandum was the word I couldn't think of understanding. Because any person who would come to see me, if they're, depending on the setting, would become a client of Goulburn Valley Health. I register them, I look after all their notes, everything travels with me, nothing stays at that site. If treatments and things are needed, it's my responsibility to get back to that person and sort that out. If the person is under 25, because I actually have networks and links with Headspace in Shepparton, then potentially the young person would become an outreach client of Headspace, which then, along with that, means their notes would be kept there, and if they had need for any other Headspace type services, they're already linked in, and it's easier to facilitate that, whether it be community working, whether it be housing, whether it be seeing someone who's specifically doing grief counselling or same-sex attracted type work, but the links are there. So again, you have the opportunity to value add into those interactions. Oops, I went too far. So as I said, through the sexual health network meetings, some of these partnerships have been built and hopefully strengthened and continue to be created. This is also often the forum where gaps in service provision have been identified and spoken to, and people have thought about, well, you know, maybe we could trial something, see if it works, and then if it is something that seems valuable and is working, look to the future as to how perhaps this could be arranged or managed differently within your own community, so almost as a pilot type project. We give a consideration of the client groups that you're wanting to attract and would like to use the service, and explore what options might be really viable for you in your setting to deliver some of these programs. And anything that I'm involved with, if you're under 18, it's free. The only cost may be associated with the cost of a script for treatments, or it's Medicare bulk billed if you're over 18. There really isn't a cost as a barrier for people coming to access clinical services. So if we look back at the type of work I can do at the hospital, this is basically where my role started, and this is then the same work that underpins any of the outreach clinics that I do and the services that I provide. At the hospital, these are some of my client groups. Would like to see more, but these are some of the people that have come to have a chat, but again, I could have seen these people basically anywhere. So again, if this resonates with some of your client groups who are not having access to sexual health services, but you think they might benefit from it, then maybe it's time for a conversation. And these are, again, some of the presentations, but most of these you could do anywhere. So, as Dawn said, I work 1 day a week at Headspace, and that came about because they have a general practitioner who works there on a Monday, and then Dawn works Wednesday, Thursday, Friday. So there was 1 day of the week where there wasn't sexual health services available. So I put my hand up to be there on a Tuesday so that they can advertise and promote that they can do sexual health every day of the week, because with young people, forward planning isn't always something that they're that good at. So it's opportunistic. If I walk in now, if I ring today, can I see someone? And it's just to help keep it on the agenda a little bit more. And these are some of the presentations that I have seen, but also through seeing young people, I've learnt now not to say, oh, have you noticed anything different or unusual for yourself, because you automatically get a no. You have to actually drill down. Have you had any change in odour? Is there any discharge? Is your skin changed at all? Do you feel anything different? You can't, or I can't just make it anything different for you. So then, with Talking to the Bridge, which is another non-government organisation that again works with young people 12 to 25 years of age who are again disadvantaged, who also has some links with Headspace, they sort of reported that their young people would benefit from sexual health consultations, but they were reluctant to go to another agency. It basically needed to be somewhere where they felt supported and felt safe. So I do outreach to Headspace, and then from Headspace I do outreach to the Bridge. And so we've been doing this now for about 12 months, where every second Thursday afternoon there is a clinic offered, not always with people booked in to see me, but it has been utilised. Mainly young women come. We have had some positive STI reports, but initially most of it was around contraception. And my question would be, if they weren't coming to talk to me about contraception, would they be going anywhere else? The Bridge has a young parenting and pregnancy type program, so I'm wondering whether perhaps the women would be rolling back into that perhaps more frequently if they didn't actually come and do this. The understanding with the clients from the Bridge was that they would be registered as Headspace clients, and that if there were any real treatments that were needed as far as complicated treatments for any STIs, if they were having Implanon inserted, if they were due for a pap test and we were going to do that, then they would actually come to Headspace for those things to happen where there was a clinical space. And the few women who did need that were then happy to come to Headspace for that to happen, because by then we'd already start to build a therapeutic relationship and they felt safe coming. And what I've actually found is that a couple of the young women I first met at the Bridge will now just make appointments to come and see me at Headspace. So it's actually helping them to start to negotiate a broader sort of health system a little bit more as well. Sometimes with their workers' support, but sometimes by themselves too. So some of the topics that they sort of came and want to know more about, even if they weren't sort of symptomatic and just sort of came up in the context of a contraception consultation, were these things. And for some, the same, I also do 2 clinics into 2 different secondary schools within the Hume region. What is normal does keep coming up. Am I okay? Who do I ask these simple questions to? So basically partnerships have enabled sexual health service delivery to reach some of our more marginalised and disadvantaged young women. Young boys do, or young men do come to not to Headspace, yes, but also to the Bridge, but they don't seem to be as many engaged. And the couple that I have met through there have actually then come to Headspace to see me. They didn't actually see me in the space at the Bridge. And whether that is again around feeling comfortable in that space or wanting to remove it to a different facet of their life, it doesn't matter, so long as they're accessing care somewhere. As I said, at the Bridge, it's a clinical room you come to. At Headspace, it's one of their interview rooms where you sit on a couch and, I set up my little laptop next to the phone on a sort of occasional table in the corner and work out of my bag, but it doesn't matter. We still can do simple things like chlamydia testing, give scripts, organise other things. We'll do depot and things in that space as well, just whatever's needed as best we can. And as I said, some clients have now independently found their way through to us and are navigating other areas of the health service, including, yes, it's okay, I would like to have a marina put in. If I refer you up to the specialist consulting rooms at the hospital, will you go up there and get it done? Yes, so they will actually start to make quite bigger steps, which is nice. So really, I feel that the pilot establishment of this type of a service is beneficial and has shown some positive outcomes. Across the region, there's evidence of a growing number of discrete services working together with support to establish more sexual health care, and it's the interagency links and partnerships that are the most important and the critical thing in establishing these. I say I go to the bridge in Shepparton. Well, the bridge in Seymour this year has asked me to start to go down there once a month to provide a service there as well. So far, no one has actually come for clinical service provision, but we will sit down and have a chat about life, the universe and everything, and eventually it comes around to sexual health, so it's still just saying someone is here if you really want to come. So that's part of the collaborative patient-centred care, hopefully, of clients that may be Headspace, maybe Goulburn Valley Health, might be the bridge, could be at a secondary school, could be anywhere effectively. Give me a bus and I'll pull up in a car park somewhere and we could equally be doing the same thing anywhere across the region. That's my paid political announcement because that's what I would like. And I thank you again for giving me the opportunity today.